I'm Dr. Ram Lakhani. I work in Lakeland, Florida, and have 2 board certifications, one in ear, nose, and throat, head and neck surgery, and the other in facial plastics and reconstructive surgery. With regard to sinuses, as I mentioned, I have 2 board certifications, and the nose specifically, I've found that rhinology, and as much as it's the science of the nose, when we do rhinoplasty to adjust or change the contour or the look of the nose, the breathing and the function of the nose are equally important, if not more important. Over the years, I've had patients that have had rhinoplasty elsewhere. They've created a nose that doesn't breathe and function, and those patients, in spite of the look of it being somewhat better, are very aggravated. So the sinus part of this has become a large part of what I do as well. And that's the reason. We want to create the form, but optimize the function. The latest or most recent advance in sinus procedures is the balloon sinuplasty. It provides a minimally or much less invasive procedure that can be done right here in the office setting. We have state-of-the-art equipment that's available for these procedures right here for us. People can be sedated comfortably and anesthetized with numbing solutions that just absorb beautifully into the nose. And you can achieve all of the goals to get the sinuses functioning in terms of no more infections, in terms of breathing, airway. You can really make the function of the nose optimal with a simple in-office procedure nowadays, whereas before it would require much more aggressive surgery in an operating room. In the office, when the procedure is done, within a day or 2, a lot of folks are up and at 'em. Whereas in the OR, the procedure used to take sometimes a week, 2 weeks, several weeks to get through the recovery. As far as infection rate, you really don't see much in the way of post-op infection. In fact, this procedure is used to treat infection. If there's an active infection, believe it or not, as the sinuses are open and drained, the infection side of it improves dramatically and sometimes immediately. There are so many symptoms that are part and parcel of knowing that your sinuses or airway are not functioning properly. Where we are in Central Florida, there are so many allergens and pollens that affect us every day. The stuffiness, the congestion, the pressure, the pain, the headaches, recurring infection with discolored drainage. Some folks will come in and comment that they have bad breath and have been to the dentist and aren't getting any better. These are all typical signs of sinusitis, and when you do have those issues, we bring you in, we take a good look, assess the nose with regard to an internal exam called endoscopy, take a very good look with CAT scans and other means to really get a good feel for what's going to be the best treatment for you. Sometimes it is just medication, and that's always where we start with the least aggressive, but yet if we have to step up and do a simple in-office procedure like the balloon sinuplasty, it turns lives around, literally. Those are truly some of the most appreciative patients that we have, those that have had the procedure and come back with very dramatic and impressive results. The procedure is done very simply in the office. Folks will come in. There are some oral medications that we prescribe that you take, and that will provide a very good amount of sedation that really is very relaxing. We bring you into the procedure room, and the rest is done with topical and a little bit of injectable numbing. The topical takes effect so well that the injections are minimal and are rarely even felt. The rest is done with the endoscopes, the cameras, the monitors. There's a small instrument called the balloon, which is basically goes very much along with the traditional angioplasty. Angioplasty is dilating open blocked heart vessels and getting the blood flow recreated. With the sinuses, they're basically obstructed areas that need to be opened. With a sinus, if you have good airflow in and out of the sinus, you're going to have a good, normal functioning sinus. The bacterial volume that is locked up in there essentially will basically go away if the airflow and drainage is recreated. So the balloon catheter goes into the natural opening of the sinus, is then dilated. It creates small fractures in that bone, and the bone is so thin that you don't even feel that part, but that opening then heals into its new, larger aperture, and that provides basically the normal function and health to the sinus. Healing thereafter is very quick. The aftercare is actually very simple. You simply use a little saline solution, rinse the nose a few times a day. We provide a prescription for a little ointment that you use. That goes on for a week to 2 weeks. But in the midst of it, you're pretty much back to your normal activities within just a few days.